Is Mr. Lucas? Yes, I see him. Mr. Lucas, I'll recognize you for an opening statement.
Thank you, Chairwoman Johnson. And good afternoon from the Science Committee hearing room in Washington, D.C. Several members are present participating in today's virtual hearing, and I can assure you we are all following CDC guidelines. In approving virtual hearings, the Rules Committee recommended the House committees make accommodation to ensure health and safety of participants. Several committees have held either in-person or hybrid-style hearings in recent weeks, and many of the members of this committee are here in Washington today. We have plenty of room, and this hearing could easily have followed suit. I want to first thank and also urge my good friend Chairwoman Johnson to continue to accommodate the in-person participation of members moving forward. Meanwhile, I want to welcome and thank our witnesses for joining us today in our first official hearing in nearly 3 months. We are fortunate to have 3 of the nation's top first responders on the panel to discuss fire and EMS department needs during the COVID-19 pandemic. As COVID-19 continues to spread in pockets around the country, our nation's first responders are the front lines and vulnerable to contracting the virus. Fire and medical emergencies don't stop during a pandemic. While many Americans have sheltered at home for the last few months, our first responders don't have that option. We must ensure they have the resources and the equipment they need to stay safe, healthy, and on the job. Firefighting activities and funding are primarily the responsibilities of state and local communities. However, for the past 18 years, the federal government has awarded competitive federal grants directly to local fire departments and emergency medical services organizations to help address a variety of equipment, training, and other related needs. The AFG awards provide funding for equipment and training to ensure the safety of our nation's first responders. SAFER awards help the departments hire, recruit, and retain firefighters to help maintain and increase the number of trained firefighters in local communities. This committee led reauthorization of those programs 2 years ago out of recognition that it was in the national interest to have well-staffed and equipped fire departments in the case of a national emergency. We didn't anticipate then what we would be now. Who would have guessed? But COVID-19 is now testing the nation's emergency preparedness system. The CARES Act, which passed on a broad bipartisan basis, included $100 million to supplement funds to help fire departments buy or be reimbursed for personal protective equipment. I understand that FEMA is processing those applications and will be making awards in the next few weeks. I know that is not as fast as many of us would like, but for a program not designed to make emergency awards, they've moved with rapid speed. We have witnesses today from organizations and fire departments, large and small, Oklahoma, Kansas, Illinois. All departments have different needs, and I look forward to their input on how we can improve the safety of our men and women on the front lines during this crisis. I thank the witnesses for being with us virtually and for their service to our nation. With that, Madam Chair, I yield back.
Thank you very much, Mr. Lucas. If there